Hi, I'm Peter Gloviczki from Mayo Clinic, Editor-in-Chief of the Journal of Vascular Surgery. For the first time this year, at the annual meeting of the SVS in San Diego, our journal will recognize the authors of the most frequently quoted paper published in the past 2 years. I have no doubt that the authors of any of the 4 papers we are going to introduce to you from the May issue of the Journal of Vascular Surgery will also have a chance one day to be recipients of this award. The Editor's Choice article this month is a prospective non-randomized study to evaluate endovascular repair of pararenal and thoracoabdominal aortic aneurysms using fenestrated branched endografts based on supraciliac sealing zones by Gustavo Oderich and colleagues from Mayo Clinic in Rochester, Minnesota. Fenestrated or branched endograft repair was performed in 127 patients using manufactured patient-specific or off-the-shelf Cook Zenith stent grafts based on supraciliac sealing zones under a physician-sponsored IDE protocol. Follow-up ranged from 30 days to 26 months and averaged 9.2 months. There was no early mortality. Complications included 4 strokes, 2 paraplegias, and 1 temporary dialysis. There were no ruptures or conversions. Kaplan-Meier estimates of patient survival at 1 year was 96%, and freedom from aortic-related interventions at 1 year was 86%. Primary and secondary patencies of 464 target vessels were excellent, 96% and 98% at 1 year. Renal function deteriorated in 11% of the patients, but no one needed permanent dialysis. Based on the interim results of this prospective study, the authors recommend following a strict clinical care pathway for treatment of complex aneurysms with fenestrated and branched endografts to achieve excellent early outcomes. The next paper is our CME paper, and this is one that you can download free of charge this month. It is entitled Durable Outcomes of Thoracic Endovascular Aortic Repair with Zenith TX1 and TX2 devices, authors Dr. Beach and colleagues from the Cleveland Clinic in Cleveland, Ohio. This physician-sponsored prospective IDE study evaluated the long-term outcomes of TEVAR in high-risk patients with descending thoracic aortic pathology. The 200 high-risk patients enrolled in this study represented a small subset of the extensive TEVAR experience of the Cleveland Clinic. 30-day mortality was 6.5%. 5-year aneurysm-related survival was 91.7% and overall survival was 55.6%. Patients with descending thoracic aneurysms had significantly worse survival than those with chronic dissections. Freedom from secondary interventions at 5 years was 75.5%. and freedom from any endoleak was 72.2% at 5 years. The authors suggest that TEVAR using the TX1 and TX2 Zenith devices is durable with an acceptable rate of reintervention and late mortality, but long-term imaging follow-up remains critical. The next paper comes from Dr. Robert Thompson's group at Washington University in St. Louis, first authored by Dr. Vemuri, entitled Clinical Presentation and Management of Arterial Thoracic Outlet Syndrome. This is a single-center retrospective cohort study of a large experience with arterial thoracic outlet syndrome. The paper has excellent illustrations using plain X-rays and CT angiogram to demonstrate the underlying pathology caused by a cervical rib or a tight costoclavicular space, and uses conventional contrast angiography to point out possible complications including subclavian artery aneurysms, thromboembolic occlusions of the brachial artery, and multiple embolic occlusions of digital arteries. Results of surgical treatment have been outstanding, including a 92% subclavian artery or graft patency at 4.5 years, paired with excellent functional outcome. This important study suggests a distinct surgical protocol designed by the senior author to achieve superior outcomes with arteriothoracic outlet syndrome. The final paper is interesting. It discusses how Google Map, a readily available GPS-based mapping tool, offers a new way to evaluate claudication. In 15 patients, walking distances determined by Google Maps correlated highly with treadmill testing and were more accurate than by history or by the walking impairment questionnaire. The authors suggest using Google Map, a GPS-based mapping tool, to measure walking distance for patients with claudication. These were just a few selected articles from our May issue. To access these free, please visit us on www.jvssurg.org. Enjoy reading all JVS journals and see you next time for the highlights of the June issue of the Journal of Vascular Surgery.